Hey everybody, my name is Melin and I work with Bridget Danner at the Women's Wellness Collaborative, where we work together to create customized health coaching programs for women who are dealing with all kinds of different, generally kind of chronic health complaints of some kind or another that they've had trouble finding adequate solutions for. So a lot of what we do is, based upon lifestyle strategies, diet, looking for oftentimes underlying causes that reside in, hormone system, in the gut, and that kind of thing, detoxification problems. And today I wanted to talk to you a little bit about SIBO. So SIBO is an acronym, SIBO, that stands for Small Intestinal Bacterial Overgrowth. And it's something that we see commonly in a lot of the clients that we work with. Many of them have common symptoms of SIBO, and some of them have symptoms that are not what you would expect to have, that wouldn't necessarily lead you to SIBO, but oftentimes things are kind of so interconnected and intertwined that it's hard to tease apart exactly what's going on until you start really doing an investigation into that. So SIBO is a condition where bacteria that shouldn't really be in the small intestine winds up in the small intestine. So quite often it's normal bacteria that should be in the colon, but it's found its way into the small intestine and is overgrowing there. Some of the common classic symptoms of SIBO include things like gas and bloating. It can also sometimes feel sort of like a rumbling in your belly after you eat, that kind of thing. Abdominal pain is very common. Distension, so even quite severe distension sometimes of the abdomen. Constipation and diarrhea are two of the most common symptoms. Some people alternate between the two, and some people are very dominant on one side of the spectrum or the other. An IBS diagnosis is another common sign of SIBO. In fact, there's some research suggesting that up to 80% of IBS cases may have a SIBO component to them. If you find yourself growing more and more sensitivities to different foods, that could be a result of having small intestinal bacterial overgrowth. So those are some of the more classic symptoms, and then other symptoms that might show up are things like skin issues or environmental sensitivities, and that's because SIBO can have some negative effects on the detoxification system. So you might start seeing the body try to detox through the skin, or becoming more and more sensitive to odors, to any kind of toxins or chemicals in the environment and that kind of thing. And it could also even show up as hormonal problems. So I don't have that one on the slide, but there are some gut bacteria that kind of, if they overgrow to a certain degree, they can impair the detoxification of things like estrogen and other hormones. So you may see it showing up like that as well. Some of the ways that we test for SIBO, well, actually the only way that I test through SIBO is through doing a breath test. There are two different types of tests that you can do. There's a lactulose test and a glucose test, and those are both sugars that you ingest at the beginning of the test period, and then you blow into little tubes every 20 minutes for a few hours. And the idea is that as you ingest these sugars, that bacteria are going to consume these sugars and produce different gases as they're moving through your GI tract. Really, you shouldn't have very much in the way of gases being produced through the small intestine, but if you see high levels of these gases after drinking these sugars when you're running this test, then that's a sign that you have SIBO. One of the things that is kind of a common issue out there is that a lot of people are becoming aware of SIBO, and a lot of people are doing protocols for SIBO. I mean, I see this happen with a lot of the clients that we work with. They may have even done a SIBO protocol that they found on the internet because they had some of the symptoms, but they didn't really know what their gas levels were. They didn't really know whether or not there were other infections present. It's really important to know these things, because otherwise you might just spend a bunch of money on some products and you might find some relief for a few weeks or even a few months, but quite often it'll recur if you don't really deal with it properly, if you don't deal with other more primary infections first, or if you don't do a long enough protocol based upon what the results of your tests are. Most of the time, I'm thinking about what are the symptoms that are present, what's been going on in a client's history that might give me a sign that they may have SIBO, and kind of what else is going on with the gut. And if I take all of those things together, then I may reach a point where I do recommend that we evaluate for SIBO. Some of the things that we do about SIBO, so there are some really proven, tested herbal protocols for SIBO. You do have to know whether you're hydrogen positive or methane positive, or hydrogen and methane positive, because that does change the protocol a little bit. I think it's always best to test so that you know what you're dealing with. And it's also important to know how high the gas levels are, because that's going to determine how long your treatment protocol might last, and how you might approach treatment and what kind of decisions you might make about your treatment based upon kind of how severe the overgrowth is. So herbal protocols are great. There are also some specialized antibiotics that can be used in certain cases, and though we don't prescribe antibiotics, sometimes we may recommend in certain cases that you work with your doctor in order to get some antibiotics, so that might be the best thing for you to do. And the antibiotics used for SIBO are very special and localized to the small intestine and tend to not be as destructive to other gut bacteria as some other antibiotics are. There's also something that's called the elemental diet, which I do only infrequently with clients because it's pretty restrictive, but it's a way of essentially starving out the bacteria in the small intestine. What's called a low FODMAPs diet can often be helpful as well, which means reducing certain kinds of sugars and carbohydrates in the diet that tend to feed the bacteria that are commonly present with SIBO. So that's a way it's different from doing an elemental diet, but same kind of idea in that you're eliminating certain foods in order to not feed the bacteria that are there. Gluten sensitivity is often an issue for people with SIBO and can sometimes be a causal factor. So a lot of times it can be a good idea to get rid of gluten. And then oftentimes we'll also support things like detoxification and making sure that those systems are working well. Minimizing your exposure to toxins and environmental toxins and toxins in your personal care products and that kind of thing is also something that we work on with you, and is an important part of anything that you're going to do to clean up the gut and reduce inflammation and get things working more optimally. And then overall, just looking at your lifestyle and making adjustments there to things like stress. I mean, stress is a number one factor in kind of altering some of the way that your immune system functions, particularly in the gut. And so that can also be a factor when you're working on something like SIBO. So these are all things that we work with and consider when we're dealing with SIBO here at Women's Wellness